today. Again, I'm Lauren Blauvelt, Executive Director of Planned Parenthood Advocates of Ohio, and I'm really excited to be joined today by Danielle Firsich, our Director of Public Policy, and Dr. Bhavik Kumar, who's our Chief Medical Officer. And we're here to bust myths, do some truth-telling, and talk about the importance of medication abortion. So I'm going to kick it off right away. Dr. Kumar, can you introduce us to medication abortion? What do we mean when we say MAB affectionately, and what can our listeners expect to, what may they not know about medication abortion?
Yeah, I think there's a lot that folks may not know about medication abortion. It's actually one of the things that I do most often in my work in abortion care. Medication abortion is an abortion with medications. Usually it's two different medications, one called mifepristone and another one called misoprostol. The first medication, often referred to as the abortion pill, mifepristone, was FDA approved in the early 2000s. So it's been around in our country for almost 25 years, a little bit more than 25 years. It's very commonly used. About 2 out of 3 people seeking an abortion choose this option. So it's very common, it's really safe, and it's really, really effective. You can actually have an abortion by taking medications in your home or wherever you feel safe. So folks get to do it on their own terms with their own privacy, have whoever they want or don't want around them, and be in control of the process. And just makes it a lot more comfortable for people that choose this option. You can use it up to 12 weeks, which is pretty much the entire first trimester. And that's where most abortions occur. So it makes it really common and really safe. And I think a lot of folks get it confused with other things like Plan B or contraceptives, but it's a very specific thing, and it's a very common, safe thing as well.
That's really awesome. This is a funny question, but the misinformation, the disinformation is so serious now. When you're talking about mifepristone or misoprostol, like, you as a provider are not getting any kind of kickback from these medications, right? Like, as like an influencer, as a provider, like, can you talk about like your confidence in, talking about medications versus like some of the stuff we hear from, some of the antis?
Yeah, these medications really are the only medications that are available and FDA approved to do what they do. So there's really no other options as far as like choices come. Mifepristone is a great medication. It's really safe as well, but there's no connection that any of us providers have to the manufacturer or anything like that. And misoprostol, the second medication that's used, it has a number of different uses. It was initially approved for peptic ulcer disease, but is used in obstetrics. Many folks that have been on the labor and delivery floor may have heard of that medication. It's used for postpartum hemorrhage and a number of other indications as well. Same thing, there's a number of different companies that make that medication. No connection with any of them, just like any other medication that I prescribe. These are just the standard regimen that's used for medication abortion, but also for miscarriage care, and what most doctors and healthcare professionals turn to for this kind of care.
Danielle, what do you hear from our legislators when it comes to medication abortion?
Well, to start, what I hear most is an absolute lack of respect for the Reproductive Freedom Amendment. We are seeing a lot of bills that are being pushed by this legislature that are clearly unconstitutional per the Reproductive Freedom Amendment, which I'll remind everyone said that the state can't directly or indirectly burden, penalize, prohibit, interfere with, or discriminate against access, and that it has to be in accordance with widely accepted and evidence-based standards of care. And this is where we're hitting a huge snag right now, because we have a couple bills in the State House that are quite literally cherry picking one single deeply flawed study. I say study very loosely in this case. This was a self-published study that was also not peer-reviewed. That is not how we create public policy. It's very important that you have evidence that you're using that is peer-reviewed and from accredited institutions. So this one single study was published, and it said that mifepristone has a serious adverse event impact in almost 11% of patients. That is wildly inaccurate. That is not what decades of research show us when it comes to the efficacy and safety of mifepristone. And the study was essentially universally discredited by all reputable researchers. The Kaiser Family Foundation came out and said that It had methodological flaws. It had a lack of transparency. It literally distorted its findings, and it also wouldn't release the data. So you can't also prove that these findings can be replicated. What's very strange is they essentially took data from insurance claims from hospitals and used those to determine whether mifepristone was particularly dangerous. And it's problematic for so many reasons. I don't even know where to start, but the issue is that it counts an abortion-related emergency room visit as a serious event, no matter why the patient went to the ER. That is wildly ridiculous. A lot of people go to the ER for a million reasons, and they're not serious adverse events that would impact them in a literal life or death manner. It also didn't quantify or qualify these visits properly. It literally had about a half of the serious adverse events were just defined as other abortion-specific complications. Which, what does that mean? That is an enormous category that doesn't even have a label. So half of the events, they didn't even tell us what the events were, and they didn't understand the difference between miscarriage or non-abortion uses of mifepristone. And like I said, the analyses can't be verified because they literally won't reveal the source of their data. So when you're creating public health policy that is going to impact Ohioans all across the state, you cannot be cherry picking flawed data that is methodologically unsound in order to attack mifepristone only as a medication that you think is uniquely dangerous simply because you yourself are anti-abortion or anti-usage of mifepristone. So we're seeing a really dangerous nexus of personal beliefs, personal policies of these legislators that they are amplifying and using to attack medication that is actually safe and used all over this country and necessary not just for abortion but for many other purposes. So that's what we're seeing right now. I can get into more details about the bills, but it's interesting that they had such a hard time finding a study that would say mifepristone is unsafe, that this one study, the Hall and Anderson report, is the only study they are relying on for every single one of these bills. So that tells you something. When they could find one thing to support their claims, and we have hundreds upon hundreds of studies done over decades, I think it tells you how skewed the game is.
Absolutely. It sounds like almost they wanted this study and someone invested in it.
I think you may be onto something, Lauren.
House Bill 324, that's the bill specifically attacking mifepristone right now in the Ohio legislature. Does it have, is it attacking more than mifepristone when it comes to medication, Danielle?
Yes. So this bill would technically allow the director of health, who should not be making these decisions in a broad scale across the state, but would allow the director of health to determine what medications have above a 5% threshold for severe adverse reactions. And it was essentially put in place extra guardrails, informed consent pieces around being able to access those medications. And what's interesting is while mifepristone is obviously the biggest target here in this category, we're also seeing the targeting of SSRIs. We have quite a strong, what they call MAHA caucus, a la RFK Jr. and his Department of Health here in the Ohio State House. And there is a lot of feelings around SSRIs and around vaccinations in particular. So this could also target any number of SSRIs, which, my goodness, good luck ripping SSRIs out of the hands of millions of Ohioans. But
I agree with you, Danielle. I just want to, when you say SSRI, do you mind let Dr. Kumar jump in and define SSRI for us, and then we'll jump back to why they're attacking it?
Yeah, that's a nice segue. SSRI stands for selective serotonin reuptake inhibitors. It's a class of medications typically used for depression and or anxiety and maybe some other causes as well.
These are medications that are taken by an unbelievable number of Americans. And again, have decades of science and research behind them. But according to a bill like this, they could take literally one study and use it as a justification for limiting access to those medications, no matter how many studies disprove it, or prove that we have decades of research behind its efficacy. So that's the dangerous piece here. It's essentially letting them cherry pick what medications they think Ohioans should and shouldn't access, which is an immense government overreach that I don't think many people would support.
Dr. Kumar, how do you see this impacting our patients, or patients who both Planned Parenthood patients, but every patient in Ohio and around that are hearing all this disinformation around medication abortion? So both the information, but also if this was to become law, what would happen?
Yeah, I think it's hugely confusing and harmful to the people that I take care of. I think even before these things become law, just hearing that it's something that's being introduced by our elected officials that we trust, have our best interest in mind, and just the conversation confuses a lot of people. When I'm taking care of patients, it's not uncommon for them to say, I read about this, or I heard about this, I Googled whatever, and this came up. And oftentimes it's some of these elected officials quoting the junk science in these papers, or spreading disinformation or misinformation. And it takes a lot of time for me and the other healthcare providers that I work with to convince people that, no, this is the real science. This is the truth. We do this work all the time. We have degrees and years of training and years of experience to look at these studies and understand it, and then prescribe these medications to you in a safe way. And if something does happen after you take the medication, we are here to take care of you, and we'll manage those things, and we'll make sure that you stay safe. That's our job as physicians and healthcare providers. So it takes a lot of effort to dispel these things when they're being introduced. If it's something like this were to become law, and then we have this huge governmental intrusion into the way we practice medicine, it's even more harmful. I think most people can identify with the fact that when you have a healthcare need, you go to your healthcare provider, and you would hope that they have a conversation with you about the risks and benefits, whether it's 2% or 5%. That may mean something very different to that individual person. So for each person, we talk about the risks, we talk about the benefits, we talk about what we know, rooted in good studies, randomized controlled trials, which are the gold star of studies that are peer reviewed. And that means that if I do a study, peers will look at it, they'll critique it. It gets sent back to the authors to, respond to that feedback. Sometimes there's multiple rounds of that. So it's very robust science. And those are the papers that we look at. But when you have the government telling you, well, this meets this threshold based on these criteria that I made, and now you have these extra restrictions on this medication, meaning that you may or may not be able to use it for your patients, it really has harmful effects, because then I have to tell patients potentially that there are these options, but we may not be able to use them. If you were in another state other than Ohio, this is the great care I'd be able to provide you. But unfortunately, we have to do this and that instead. And who knows what restrictions they'll place, whether it's extra administrative work, extra paperwork, extra things for the patient. Sometimes it starts off small and then it grows. But again, I think what we've seen is anytime there's governmental intrusion into the patient-physician relationship, it's never helpful for the patient. Those private decisions should stay between a patient and their provider, and they should have that conversation. And that's the same thing for mifepristone. And really what I worry most about when I hear things like this, that they're creating these arbitrary standards for these very safe medications that are unnecessary. And I'll also just note that one of the most recent papers that came out of the National Academies of Science Engineering, I forgot what the acronym stands for, I think medicine, showed that mifepristone is actually safer than other common medications like penicillin and Tylenol. So some of the very everyday medications that we use, or things that we see and think are just safe and they've been around forever, actually have a risk profile that's very different when you start categorizing things as serious or not serious, which is why we just should avoid it. And again, have those conversations between patients and their providers, and let individuals choose what's best for them.
Absolutely. Ohio patients, Ohio communities deserve to be able to make healthcare decisions with their providers. And we saw Ohio voters speak loud and clear in 2023 when they 57% said, especially around reproductive health care, but that they were going to make the decision themselves. They did not want the government involved, and yet here we have again the government involved. So what can listeners do, Danielle, to speak up and make sure our lawmakers are hearing from them now? Because 2023 is not going to be the last time these lawmakers need to hear from our supporters.
Sure. So we have somewhere around a dozen bills that are directly attacking the Reproductive Freedom Amendment right now. And if you have any personal experience utilizing these medications or these services or these procedures, that is personal expertise. That matters. And Dr. Kumar and I could nerd out all day with the data and the research and the studies, but that's not quite as important to them as the actual personal stories and personal connections that communities have to this care, especially in a state like Ohio where they were ready to chop 750,000 people off the Medicaid expansion rolls. We've seen people's healthcare premiums absolutely skyrocket. People can barely afford their daily living expenses right now. So adding additional barriers onto families is a really dangerous thing right now, and especially when we pay these people's salaries. We pay for the people's house, the state house. This is a massive waste of taxpayer resources and taxpayer money sitting here and relitigating pieces of legislation that are blatantly unconstitutional. And we've already had decisions in quite a few cases that said that increased travel, increased visits, increased burdens carry financial, physical, and emotional costs for patients for which they cannot be made whole. That's a really incredible thing for the judiciary to say. We also had them in one of the decisions say that medication abortion and abortion in general are among the safest treatments in contemporary medical practice and entirely protected by the Reproductive Freedom Amendment. So if you are someone who has any experience in having to travel for healthcare, to have any kind of procedure, if you are reliant on any kind of reproductive healthcare, if you have had fertility issues, if you have had a miscarriage, there are so many ways that the legislature is trying to either increase surveillance and decide how or when or what information they're allowed to have about you, whether or not it is HIPAA protected or not. They are trying to determine whether you have access to medications that are often life-saving and life-affirming for folks. So there are a number of bills that you can contact the legislature about. The most important thing is usually if there is a specific bill, say HB 324 is an example, right? Attacking mifepristone. It is in the House Health Committee. So contacting the chair of that committee is really important. They're essentially the person who holds all the power. They're the ones who decides whether a bill gets a hearing, how many hearings it gets, how they schedule those hearings, because they often will skew the hearings, surprise, surprise, so that proponents of abortion bans get way more time and way more notice than the rest of us. So it's really important to contact the chairs of those committees, especially if they are from a district that voted for issue 1. A bunch of these legislators are going against their own voters in their own counties and their own districts. And I would find that particularly insulting if I was somebody who is represented by that person, because they are supposed to represent you and your needs and your desires and what you ask of them, not their own personal vendettas that they may have at the State House. So I think contacting the chairs, submitting testimony, it is a really empowering and credible experience to be able to speak truth to power and to also have that on the record. I think people, more than anything right now, want to feel like somebody is fighting for them. They want to hear the truth. They want to see people challenged in real time. They're sick of gaslighting. They're sick of the paternalistic way the State House tells people what's best for them, as if grown adults cannot make those decisions. So I think get your voice out there, get your community involved, show up at the State House for these hearings. If you can't, because it's during a workday, submit written testimony. If there's going to be a vote at the House or the Senate, come join us. We'll be there and making a big stink about this. And it really is important, because before the Reproductive Freedom Amendment passed, I think a huge thing that saved us from having to meet the 60% threshold that they tried to put on the ballot was the fact that people really showed out against the bill that would have done that. HJR 1 was so unpopular that the crowds at the State House were probably the biggest I've seen so far in this job. And they got people to turn out for an August special election that usually has a 4% turnout rate, and we had almost general election level turnout for an August special election. So like, it matters if you have attention here. It matters if you have bodies in the State House, in the streets talking about these issues, because unfortunately, a lot of people assume that the Reproductive Freedom Amendment was the end all be all, and they don't realize that we have a huge battle ahead of us, getting rid of all the prior restrictions, and then having to go before the courts and make that argument when we have a Supreme Court that is 6-1 conservative anti-abortion right now. So the stakes honestly couldn't be higher.
And we are with you in this fight. So there are links below where you can click on House Bill 324 or its Senate companion bill. So we can connect you directly to your lawmaker, directly to the chair, and follow us on social media so you can continue to lift up the truth about medication abortion and the reality that we have to continue to fight our lawmakers no matter what. And we have to pay attention to what they're doing. Because on one hand, we see the attacks on mifepristone specifically, as well as other medications based on this bogus study. We also see them, Danielle mentioned the MAHA caucus, and I would be remiss if I didn't bring forward to everyone the other shenanigans that our lawmakers are doing at the same time they're attacking medication that has over 25 years of medical experience. They are following, so I'll be honest, I've been doing this work for 16 years. I've been following the State House a long time. So the silliness that comes out of the State House often doesn't surprise me. I kind of expect it all. But I wish there had been a camera for the day that I had to ask Danielle to explain what in the world is happening around horse dewormers or something that I had the benefit of not knowing. So maybe some listeners didn't know either. But Danielle, tell us what happened at the State House, and then Dr. Kumar, tell us why that should never happen, shouldn't be happening.
I don't know this story. I'm excited to hear it.
It's a dude.
At the same hearing as they're attacking medication abortion.
Yes. In the
Set the
exact
stage.
same committee where they are attacking medication abortion, they are during the largest measles outbreaks in decades, having a bill called the Choice Act that would allow for there to be exceptions for children to have vaccinations before being admitted into school and or other programs, etc. And then the real kicker is the bill that Lauren is referring to that would allow for the over-the-counter usage of ivermectin, which if you have an animal, a dog, a cat, a horse, there are many possibilities. If you have them, they might take something every month called HeartGuard to make sure that they don't get heartworms. Ivermectin is in massive letters on the top of that medication that I give to my elderly chihuahua every single month. Not meant for humans. I think that couldn't possibly be more obvious, but this is part of the misinformation and disinformation campaign that happened during COVID and post-COVID. So we know that a lot of people have insisted that we should have access to medication like ivermectin, which they think for some reason is more effective in treating a respiratory disease. Don't ask me why. But we now have the sponsor of that bill literally gave his entire sponsor testimony admitting, A, he's using ivermectin for cancer treatment, which, Dr. Kumar, help me out, my friend. That seems crazy. And B, that he went to Mexico and smuggled it across the border back to the United States to use it. And this was all said on the record on camera.
I don't know where to start with that. This is so absurd. It's why are you taking this random medication for cancer? I mean, I really hope that person is getting care elsewhere for their cancer, and I wish them well, but I don't know if ivermectin treating any cancer. It's a worm medicine. It's used for humans as well. I don't think I've ever prescribed it for any patients of mine. It's a very specific class of worms that it treats, usually if you've traveled to a certain country that has that kind of worm. I'd have to look back at my medical school textbooks because it's such a rare medication. But like you said, it was something that made headlines during the COVID pandemic where it was touted as a treatment based on nothing, essentially. And I'm not surprised to see it packaged with anti-vaccine things, anti-abortion things, because it's the same group of folks that are against this, that are against and trans protections and protections for all the things that we provide at Planned Parenthood. It's all the same people having the same bogus claims against the good work that we're doing. I think it is just really, really harmful. And you mentioned the measles outbreak, and these things do have real consequences. And even anytime ivermectin comes up, people are curious, and it's understandable that they would have this curiosity. It's unfortunate because it's rooted in false science. So just to anyone listening, do not take ivermectin unless your healthcare provider prescribes it for you. And I'm assuming it's going to be related to some sort of worm condition. But just be careful with all these things that unfortunately our elected officials are touting, and talk to your healthcare provider before you make any decisions. And please come see us at Planned Parenthood if you need a healthcare provider. We're happy to talk to you about all of this, rooted in real science that's backed up.
Absolutely. I mean, and you're so right, Dr. Kumar. Like, it's funny. It's funny to have a lawmaker talk about breaking the law but it's also not, because people's lives are at stake, and the misinformation and disinformation is making everything worse, and it is so political. That's what I hear in this, is that they are cherry picking. They're choosing which medications they want to be against, and they want to send misinformation about, and then they're choosing other medications for their own reasons that politically they've decided are good, and just frankly, back me up, but medication shouldn't be political. It shouldn't, whether or not you decide to take a medication should be about your health care, and who better to make that decision with than your healthcare provider, than the Ohio legislature, who again just have to be elected. They don't have to have any qualifications besides your vote. So your vote also matters, because you set the qualifications for the folks who are representing you.
Yeah, I think for folks that are listening, just think about if you were sick and you went to the clinic or the emergency room, do you want that legislator there telling you what medications to take? Or do you want somebody who's been to medical school, been to residency, and is taking care of hundreds, if not thousands of patients, knows the science and can recite it for you, can go over the risks and benefits, can answer your questions? I think the answer is easy, but I think when we're removed from the situation, sometimes we may give more credit to a legislator, thinking that they may have our best interest in mind, but that's not the person you want taking care of you. So if you don't want them taking care of you, then don't trust their decisions that aren't rooted in science. And I think it's an easy decision at that point.
And I think what's most upsetting to me sometimes about these bills is that they add to this amplification of the death of expertise that these people are pushing. They have no personal, professional, or educational experience in any of these categories, but think that they should be paternalistically dictating to us what care we should have access to. And it's frankly also a huge insult to medical providers in general, because all of these bills are also saying your medical providers, A, don't know how to get informed consent, B, don't know what they're talking about, C, don't have your best interests at heart, and D, they're the political ones. They're the ones who are influencing you to get that abortion or get gender-affirming care, right? So if I were a medical provider in this state, I would be devastated by the obvious view that this legislature has on me and my profession, because they're pretty adamantly saying, you have no idea what you're doing, and let us tell you how to do your job.
Yeah, I think it's such a slippery slope when it comes to the government interfering in the practice of medicine. Right now, it may feel like it's just abortion or providing trans care, but it's a slippery slope. And I think more and more we're seeing that in other states, especially in the South, where it's gone from just one thing to several things. And the governmental overreach into medicine has made it so difficult for some folks to provide care that they've actually left the state to practice elsewhere. And we're also seeing an increase in morbidity in these states and mortality as well. And so these things have consequences. And once they start to get a little bit of leeway, they just continue on into the next topic. And so I wish I could say, I know what's next. And in some ways we do, because we've seen a little bit of their playbook. But I think access to contraceptives, fertility care has come up quite a bit. Access to HIV prevention medications has come up quite a bit as well. And there's probably other things that they're considering, but this probably will affect most people, or at least somebody that you know. And so it's really important that people step up and push back on this governmental intrusion.
As a reminder, how safe is mifepristone? What percentage?
It's super safe. I mean, the serious adverse effects that mifepristone can have is less than 1%. I think there's a couple of zeros in there. So when we hear that, I mean, I chuckle because it's a non-issue, and to hear so much attention from our elected officials on this and so many people's energy and time into something that is like not an issue for me as a provider of abortion care, I can't help but chuckle because it's a non-issue. So the serious adverse effects are less than 1%. I was just looking at our statistics for where we provide care, and it remains true that it's less than 1%. Most of those adverse effects are things that we can manage within the health center. Usually, sometimes there's retained tissue or other things where somebody may need to come in for additional care, but nothing that I'm ever concerned about. It's super rare that I have to send somebody to the emergency room. Most things can be managed within the health center. Most people don't need to come back, but if they do, it's something that we can take care of. They don't have to go to the hospital. They don't have to stay in the hospital. It's much safer than carrying a pregnancy to term. So it's still a very, very safe, I wouldn't even call it a procedure, but a safe set of medications that's common and effective.
So for our listeners who want to take action, there are links posted below that you can click on to talk to your lawmakers, especially if you have a personal story. But if you want to share because you want to support science, because you want to support access for your community, your voice also matters. So please take action with us and share this episode, share on social media. It's going to take all of us to continue busting these myths. It's important for our patients, for our community members, for young people to be able to have the tools to make decisions for themselves, and even the understanding that they can have these conversations with a provider. And what a great place to start than Planned Parenthood here in Ohio. Any last words, Danielle?
Oh my goodness. You have to hold these people accountable, and you have to do it every single day at every single turn, because if you give them the smallest bit of space to maneuver, they will do so. And again, this is not accidental, it is intentional. They know better. For the bill that would reinstate the 24-hour waiting period, it has been blocked by a statewide preliminary injunction for almost 2 years. Yet, the man who introduced it is a lawyer who fully understands how the legal system works, understands what a preliminary injunction is, and still thought, LOL, let me introduce this bill and let's try to bring it back, despite the court decision. So these things are intentional. Don't allow yourselves to be gaslit. Don't allow yourself to be exhausted. They are trying to create chaos. They're trying to create disinformation so that you are exhausted into some kind of apathy. And I know that sometimes it can be unbelievably hard to stay active and to really pay attention. But I'm telling you right now, later on, you are going to want to have been on the record fighting against these things and trying to protect something that Ohioans collectively voted for.
Yeah, I was just thinking about, I enjoy seeing patients and taking care of people. That's what I went to school for, and what I enjoy. It's a privilege to hear their stories and to be able to provide them with healthcare. But unfortunately, politics has and continues to enter our health center over and over again, and forces people like me to speak up and to speak out about some of the disinformation that our elected officials are spewing. So it is great to work with a great team of people like Lauren and Danielle, but I'm really thankful for everyone who's listening, just to listen and stay informed, but especially for the folks that are doing something about it. The smallest things, such as just talking to your friends and family or sharing a link, are important. But even those that go further and share their stories and are public about this, it's really helpful. It makes a difference. Every little thing makes a difference. And it allows me and the great folks that I work with in the health center to do our jobs. So thank you. And like Daniel said, don't give up. Keep fighting. They will keep doing this every year over and over again. Their stuff will become more and more bogus. And we're depending on all of you listening to help us push back. We know that we stand in the truth. We stand in the light. It's easier when we're not making stuff up and pulling stuff out of our ass. And so, not that it's easy, but it's much easier when I can say, my patients say this to me every day, or you have a story that you're sharing from your own perspective, or you're just amplifying some of the things that we've shared. It all makes a difference. So thank you to everyone.
please click on the links below, call your legislator, continue to share both the episodes as well as everything on social media or an email, and we'll be back with our next episode, continuing to bust myths, speak truth to power, and celebrate, the joys that, like, being right, being in the light. I love that, Dr. Kumar. We're not giving up. We're going to fight for the Ohio Reproductive Freedom Amendment, but even more so, we're fighting for healthy and thriving lives for Ohioans and everyone really across the globe. So we're all in this together. Times are tough, but thank you, everybody, for being with us.
That's a wrap, babe. And remember, autonomy needs all of us to rise. Like, subscribe, and share this with the group chat. Support the work by donating to Planned Parenthood Advocates of Ohio at ppao.org and text CARE, C-A-R-E, to 22422 to protect Medicaid and Planned Parenthood. See y'all later.